Gender affirmation, facial feminization is a very niche area of plastic surgery that I really enjoy doing. And for many reasons, because not only does it give patients a true confidence in their identity, their appearance, and their femininity, but also it's a very satisfying surgery from the standpoint of aesthetics. We can really optimize facial shape by addressing bone structure and all the layers of tissue. Let me tell you about the 3 most common procedures that I do for facial feminization surgery. First, focusing on the eye region. Oftentimes, if a patient is affirming her gender from male to female, then oftentimes there is an appearance of the brows and the eyelids and the corner of the eyes that look more masculine. Specifically, male appearing brows tend to be horizontal and straight, and what we want for facial feminization is to arch the brow slightly and lift the corner of the eye. So I'll do that with an endoscopic technique, lateral brow lift, and canthoplasty. Canthoplasty techniques, also called fox eye surgery, can take the form of either an endoscopic lifting of the corner of the eye, or sometimes I'll anchor the corner of the eye tissues to the eye socket bone right here. Very powerful methods to really shape the eyes in a way to help patients affirm more of a feminized appearance. Oftentimes the forehead and frontal bone, meaning the bone that is oftentimes projected, giving the appearance of a very prominent forehead, can be softened by setting back that bone as well as fat grafting through the forehead. That's one section of surgery, one type of surgery that I'll do often. The other areas of facial surgery relate to the bone structure of the jaw. Specifically, the width of the jaw can be too wide for a more heart-shaped feminine face, and so I'll often do facial feminization V-line jaw slimming, meaning I'm removing the back of the jaw bone, this section right here, which can result in a more heart-shaped lower facial frame. It also can narrow the lower face, which is important for facial feminization because a male jaw structure is typically wider and has a very prominent edge. Chin surgery is a very important aspect of this as well, to set back the chin, make the chin look more slender, and oftentimes I'm contouring either through a genioplasty setback maneuver or shaving down the sides to really slim the lower face. The third area of facial feminization surgery relates to the mid-face, or the middle portion here where the cheekbones and the cheek tissues lie. Oftentimes a male cheek is set back and is very flat, whereas what we want for facial feminization, we want more contour, more projection, more rounded apple of the cheek. Oftentimes I'm using these porous polyethylene implants, which are really the gold standard for skeletal augmentation in the mid-face. I place these oftentimes through an endoscopic brow lift approach into the mid-face cheek region to augment and project. They're slender, it gives a subtle improvement, but very powerful to give more of a heart shape to the mid-face and a softer contour. I'll often combine this with a mid-face lift and lower blepharoplasty to really perfect that area, and fat grafting to soften the face as well as to volumize the lips. Overall, facial feminization is a powerful way to really restore a patient's identity and do it in a way that gives them natural, refreshed, and very feminine results.